Good afternoon, everyone. Welcome to our Connecting Across Health Equity Datasets webinar. This is our first Community Health Equity Initiative webinar of the fall, and we're happy to have you all back. Hope you had restful summers, got some sunshine, and we're happy to be back together. Next slide. I'm McKean Scharf. I am a epidemiologist with the Community Health Equity Initiative, or CHEI. And like I said, happy to have you here today. Here's our agenda. We'll do a quick welcome. I will do an overview of CHEI and our survey, CHES. We will move into our focus for today, which is connecting across health equity data sets. We'll have some time for breakout groups, for connection and discussion, and then end with a wrap up and talk about next steps. So again, welcome from the CHEI team, McKean Scharf with DPH. My teammate Isabella, who usually joins, is not able to today, but she sends her best. We also have the Metropolitan Area Planning Commission, MAPC. We have Barry and Tanaya, and the Public Health Institute of Western Mass, Rebecca and Kelly. So welcome from all of us. Thanks for being here. So we're just going to start out with a quick word cloud in one word. I know that's hard. Tell us why you joined us today for the webinar. Thanks everyone for bearing with us. So we're seeing learning coming up, equity, information, equity nerdy, updates, knowledge, find what's missing, connections, data rocks, I agree. Seeing a couple around connecting, getting resources, comparing. Feel free to keep adding to that. We always want to know why you're here, what brings you here, so we can better serve you, but I think we'll move on. So a quick overview about our initiative. DPH's Community Health Initiative, Community Health Equity Initiative, or CHEI, collects data on health, economic, and community conditions in Massachusetts, with a focus on residents who experience health inequities. We have two data sources. We have quantitative data from the Community Health Equity Survey, which the most recent version went out in 2023. We also collect qualitative data with some partners at Tufts through the collaboration with community evaluators who collect information about topics in our survey and from communities of focus. And those reports will be coming out soon, so we're excited to share them. The purpose of CHEI is to collaborate with community, state, and local partners like all of you in using data to drive funding, programming, and policy change to advance health equity. So a little bit more about our survey. Like I said, the last round went out in 2023. And we partnered with over 100 partners to develop that survey and help us get it out. So data collected was collected from August to November of 2023. And the survey was available online and mostly taken that way. There was also the opportunity to take a paper version, and it was available in 11 written languages and ASL. It was open to residents in Massachusetts, 14 and older, and we set goals for each of our communities of focus just to ensure that we had representation and sample sizes were big enough to do intersectional analyses. and then worked with partners like many of you to get the survey out and get responses. And we had over 18,000 Massachusetts residents respond to our survey. Here are our communities of focus. Like I said, we center communities that are often underrepresented in data systems and most impacted by health inequities. Those include immigrants, older adults, age 60 and older, parents and caregivers of children and youth with special healthcare needs, parents under 25, people who identify as LGBTQ+, people of color, people whose primary language is not English, people with disabilities, pregnant people and parents of young children, rural residents, veterans, and youth and young adults age 14 to 24. And here are our survey topics. I think many of you are familiar with our survey, so I won't run through all of them, but we collect demographic information and then look at a range of topics that influence health and are related to health, as well as some health outcomes around mental health, chronic disease. And we have been analyzing these data, and we have one report so far out, but we've been working on many others and are excited to share some more data with you all soon. So this webinar today is focused on data and action, and this is the data and action framework that we use. As you can see, it's interlocking gears with the goal of moving in a positive upward direction. We like to think of it as a cyclical process. So equity, voice, and power sharing are centered in the middle. And then around that, we define our problem, analyze and interpret the data that we're using to explore it, prioritize based on those data, act, and then evaluate. And you can enter this sort of at any point, and we'll talk a little bit more about that. But we're here to support you through all the pieces of the data and action framework. So here's a little bit about our impact so far. We're also working on an impact report, which will be coming. We have received 114 data requests from our community partners, and our RDA providers at CHEI and MAPC have been hard at work meeting those data requests and getting data back to you all. We've had over $100,000 of successful grants awarded to applicants who use CHEI data in their applications. We have over 21 partner organizations who have used CHEI data to inform their programming, and over 18 partners organizations who've used CHEI data to inform policy or advocacy. I'll make a little plug that these numbers come from the feedback survey we send you, or the follow-up survey after you get some data, to let us know how you're using the data. So a gentle reminder, if you have not filled that out and received it, or if you do receive it, to please fill that out, because it lets us know how you all are using our data, and how we can better support you. So a little bit about what data can do for you, and we'll get more into this, but if you want to know more, so you can use data to learn about people in your community or region. It can help your organization refine your programming or start new programming to meet needs. You can reach out to other communities that may benefit from the services you provide based on what you see in the data. If you feel like I don't need more data, I already know enough, there's also an opportunity to use data. It can help you make the case for the importance of your work, whether that's for additional funding or to your current funders or other decision makers. So grant applications, advocacy materials, or other communication materials that will be helpful to share the important work that you all do. CHEI data can also be used in combination with other data sets, as well as the lived experiences of community members, some of which we capture in our qualitative data collection, but we know you all work in the community and have your own lived experiences as well. And we hope you'll take action to advance health equity using a combination of data and experience. We have to acknowledge that there are some strengths and some limitations of the CHEI data sets, specifically the Community Health Equity Survey. So we have in-depth data on our communities of focus because that's where we're focused. We have the ability to break down by these identities, some of which are underrepresented in other data sets. And we can link our data. Our data can be used to link social determinants of health or upstream drivers of health to health outcomes. As you saw in the topics, we cover a wide range of topics that are upstream drivers. And it can be used to answer questions about residents' experiences, barriers, and priorities. There are also some limitations to our data. Excuse me. People who respond to our survey weren't randomly selected. We partnered with community-based organizations to collect that data, and so results might not be representative or generalizable to other groups. And therefore, we can't answer questions specifically about what or how many people are experiencing a health outcome. We also don't have a large enough sample size for some of our smaller geographies or identity groups. All of these limitations can be addressed, and if you have questions about how to deal with some of the limitations, whether it's bringing in other data sets or thinking about other data you might look at, please reach out to our RDA providers who can help you think through that. So I think I'm passing it off now. Yes, I'm going to pass it off to Barry Keppert from MAPC to take it away from here.
Thank you, McCain. So taking off from where McCain left us in terms of strengths and limitations, just like any place where we go to find data, not just the Community Health Equity Survey, but other data sources are going to offer the same dimensions as well. A place where they're really strong and can really help in a story, but also a set of things that may act as a caveat or something that says we can't tell the full story because of limitations around the data. So what that means is often that we're turning to multiple sources of information or data to be able to help us tell our story. And I imagine many, if not most of us on this call can relate to that. You're using maybe some demographic information. You might be using some economic information. You might be using some information about the environment and bringing all that together too. And so we have a really wonderful chance today to learn about a Massachusetts Department of Public Health resource that really kind of pulls from many of those data sources and can be used to kind of either emphasize or potentially reinforce some of the data that we find from the Community Health Equity Survey too. So we're really excited about that. And for folks who are just joining us, we're going to have this presentation, And then we'll have time afterwards to connect amongst ourselves, to share each other's experiences and perspectives, really thinking that so much of what we can learn from is from the kind of lived and worked experience that you all have, and want to use that space we have together today. We can go to the next slide. Next slide. Um, Before we do that, we just want to check in with you one more time. I think Rebecca will drop the link again in the chat. Well, what you see in front of you is a Mentimeter, and what we're trying to do is get your thoughts. If you have, we'd love to hear from you about what data sources that you're aware of from the Massachusetts Department of Public Health. Is it the Public Health Information Tool or FIT dashboards? Is it the Environmental Public Health Tracking Tool? Is it the data that brings us together today, the Community Health Equity Initiative or survey data? Is it the Massachusetts Health Data Tool we're about to learn about in a second? Maybe you're ahead of the curve there. Or is it something else? And if it is something else, we'd love for you to drop it in the chat both so that we can be aware, but in case we can give a shout back to others as well too. So is it the FIT dashboards? Is it the Environmental Public Health Tool? Is it CHEI? Is it the Massachusetts Health Data Tool? Or is it other? And other can also mean none of these or something else that you might be using.
Sounds like folks are only able to select one, so maybe your favorite one.
Yes, your favorite, the one you go to most frequently. Yeah.
I hope to see a lot of CHEI come in now.
Feels like we might have some early learners based on the Massachusetts Healthy Data Tool too. So we have to invite in some of that experience. Oh, cool. Immunization survey data. Some folks are sharing essentially that this is maybe the first time seeing that these are places where data was available. Awesome. We'll keep the answers coming in, but gives us a little bit of sense of essentially what people are thinking about and kind of what data they may know or not know about, and what they might use at the moment too. Birth and death reports. Thanks, Amy, for that one. Rebecca, I might have us go to the next slide. And kind of within this theme, when we're talking about these, and it probably would have been helpful if we had the opportunity for more than one response, but all of the above, just like Nasira offered in the chat, this idea of how we bring these different data sets together, and sometimes we'll call that data triangulation too. So I'm sure most of you can picture it, but you picture that triangle in your head with those 3 points maybe gives us a little bit more ability to tell a story or understand a situation than if we just have that one data point or that period. But that idea, if we have a triangle, we can be part of that too. So I'm going to turn it over to Sumire, who's here to join us today to talk about the Massachusetts Health Data Tool, but we may have some other experts here with us as well today too. So really excited to have you all. I'm Sumire. I'm going to turn it over to you, and you should have the opportunity to share your screen from there.
Awesome. Thank you so much, Barry and Kane. Hi, everyone. My name is Sumire Maki. I use the she series pronouns. I am with the Department of Public Health and have the role as the Massachusetts Health Data Tool Manager. And as my title suggests, I am going to speak a little bit about that resource today. And if you could give me 1 second to share my slides. All right. If you could let me know when you see them, that would be great.
We can see them.
Awesome. Okay. All right. So happy to be here. Really excited to talk about this resource with you all. It looks like some of you may already be familiar with the tool, which is awesome. And I know for some folks, they might have been familiar with the tool when it was called the FIT, or the Public Health Information Tool. So I'll be clarifying a little bit of some of the differences there, since things have changed. The Massachusetts Health Data Tool has gotten a bit of a makeover. So this may be a refresher for some, and for some others, it may be brand new. And regardless, I'm hoping by the end, you'll have a good sense of how you can use the Massachusetts Health Data Tool, and how it can supplement data resources like the CHEI. All right, so This is going to be an overview of what I'll be talking about. I'm going to give a high-level snapshot of the Massachusetts Health Data Tool. I'm also going to share a little bit about national data sets, since those are the type of data sets we reference most in the tool. And then going to share how you can access the Massachusetts Health Data Tool along with other resources, and close out with Q&A. And before I begin sharing about the tool, I want to offer some framing that's going to echo what Barry shared by saying that data really is a powerful storytelling tool. And at the same time, I recognize that it can be a complicated one, and it's far from perfect. And I think a reason why it's so important to look at more than one resource is so that we can have a better and fuller picture of a community's health and well-being. And I also want to borrow some framing that I have heard the CHEI team actually use in the past and have really appreciated, which is that the health and racial inequities shown in the Massachusetts Health Data Tool is not new information for a lot of people. And I want to recognize that. And the purpose of the Massachusetts Health Data Tool is to make data as accessible as possible, so that it can be used as a resource for funding and policy making, which I will share a little bit more about. And if you want to follow along and pull up the Massachusetts Health Data Tool as I speak about it, you can go to healthdatatool.mass.gov, which I will also chat in. And this is our new homepage. All right, so what is the Massachusetts Health Data Tool? Well, the Massachusetts Health Data Tool is a place to learn about the health of people who are born, live, learn, work, play, and age in Massachusetts. It's a completely free and public resource. As you'll see, as you click on the link, it covers over 300 data reports or data indicators, as we like to call them, from over 60 different data sets, mostly national data sets. And it covers topics like population demographics, social determinants of health topics, health outcomes, and more, which I can share a little bit more about. The data that's offered is offered at various geographic levels, such as the town, county, state, and then we also have some custom regions for specific programs at DPH. And you'll notice as I'm talking, the Massachusetts Health Data Tool uses secondary data, so data that's actually already available and already public through national data sets, but actually might be inaccessible for a lot of folks because the data tends to live in really large files and require cleanup and analysis. And really the goal of this tool is to make that data a little bit more accessible for everyone, because that data should be accessible and available to everyone, regardless of where and how it lives. And so you might be asking who uses the tool? And the answer is really everyone and anyone. We have about 500 to 600 users monthly, I would say, and includes mostly community-based organizations, local boards of health, grant writers, academic faculty and staff, and even DPH staff. And it really is a resource that can be used to quantify needs assessments, perhaps even program evaluation, and it could be used to strengthen grant writing. And you can do that by comparing the data at the town, county, and state level. That's a feature that we have available in the tool. And you might also want to compare that data with another source of data like the CHEI. And the Massachusetts Health Data Tool can help quantify and share with others about particular inequities and particular strengths in your communities with others as well. And for some, it may help them identify new inequities. All right, so these are the data topics that are covered in the Massachusetts Health Data Tool. I'm going to give a second so folks can read this slide. I know there's a lot of text. But some topics that are covered are population demographics, healthcare access, alcohol and substance use, violence and safety, environmental concerns, chronic disease, I mentioned that, and infectious diseases, physical activity, maternal and child health, food access, education and youth development, emergency preparedness, along with other topics. And these are the data sources that the Massachusetts Health Data Tool uses most. I mentioned earlier that we use over 60 different data sets. These are our top data sets. We mostly, I think 40% of our data reports reference the American Community Survey. And we also do have some DPH specific data as well. For example, we use electronic health record data to show health outcome data in the tool. All right, so I mentioned that a lot of the Massachusetts Health Data Tool uses national data sets and wanted to share a little bit more about strengths and limitations of using a national data set. National data sets tend to be reliable because they use larger sample sizes. And what I mean by that is oftentimes data is collected from randomized smaller groups to estimate what might be truer for a bigger group, because getting data from every single person can be difficult. And so in order to ensure that data is accurate and representative as possible, larger sample sizes can help a lot. And not all national data sets do this, but for the national data sets we use, there is granular data at the town and county level available, which can be really helpful for doing that comparison of towns, of counties, or some of that benchmarking. And the amount, given the amount of larger data that is available, it's not all the time, but allows for more disaggregation or breakdowns of data by the demographic, by demographic. So we can understand how outcomes can look different across communities. And it's definitely not perfect. There are a lot of limitations for using national data sets as well, and why supplementing national data sets with other data sets like the CHEI might be helpful. You'll notice a lot of the limitations are actually the strengths of the CHEI. And for one, national data sets were limited by how they define race, ethnicity, gender, and language groups. So for example, when race is defined by limited categories, I know historically it's been defined by 5 categories. We don't really get to understand the differences and the nuances that can exist within these broad categories. And I think the American Community Survey just recently added a Middle Eastern or North African category or option for self-identifying. And previously, this population was combined with white, which is not accurate at all. And as another example, I recently learned the way ACS, or the American Community Survey, groups languages combines Cape Verdean Creole with Portuguese. And those are 2 very different languages. And given that we have a large Cape Verdean community in Massachusetts, having those 2 languages combined definitely doesn't help when we're trying to create language appropriate materials. And for many other reasons, national data sets can underrepresent certain communities. So you'll notice a lot of the communities that are underrepresented in national data sets, the CHEI focuses on, which is a strength of the CHEI, like McKay mentioned. So this can include Native American communities, LGBTQ plus populations, people with disabilities, and people who are unhoused or experiencing homelessness, and so many more communities, and also people who are more than just one of those identities as well, or are within those communities as well. And the last limitation, or one of the limitations of national data sets, is that they can be delayed. In a lot of federal data sets, the most recent data sets tend to be from 2020, 2021, which is more than 4 to 5 years ago. The ones we use, the most recent ones tend to be from 2023, but again, there can be still a little bit of a delay. And then I did not add this to my slide, but the national data sets also don't capture qualitative data and can be missing that aspect of someone's lived experience as well. So with those limitations in mind, we are continuously improving the Massachusetts Health Data Tool to ensure that we are contextualizing the data and disaggregating the data that exists in the Massachusetts Health Data Tool as much as possible. Because like I said, data is a storytelling tool, and we want to make sure that storytelling is done as accurately as possible. We're also working to improve the website and user experience as much as possible. So if you all have any feedback on how we can make not only the data, but also the experience of using the tool better, please let us know. And we're always offering technical assistance or support to anyone who needs it as well. And so the homepage of the Massachusetts Health Data Tool is healthdatatool.mass.gov, but you can also find it in our DPH data library alongside the CHEI and other DPH data resources. And if you're looking for more DPH specific data that are managed by various offices and bureaus, I know there was some mention of dashboards earlier in the chat. You can find them in the data library. I know for people who have used the Massachusetts Health Data Tool before, in the past, when it was called the Population Health Information Tool, you might be wondering what the differences between the two are. So the Massachusetts Health Data Tool is a query tool that includes mostly national data sets and some DPH data. The FIT, or the Population Health Information Tool program, now oversees DPH specific data, which is a collection of dashboards that can be found on the data library. And I will chat in a link to that as well. Oh, thank you, Rebecca. And here is my email. If you have any questions about the Massachusetts Health Data Tool, or would like any technical assistance, or would even like to host an informational session with your team, I'm happy to do that. Please feel free to reach out to me. And then the last thing I will say, as I was speaking to the data library, is that I recognize, and it's a challenge for me, even that data is so fragmented across DPH, but in general, right? And that can be confusing for myself and for others in understanding where to go for what data. And I'm closely working with the Data Modernization Initiative team to make sure we're centralizing that data as much as possible. And I know the data library is a first step towards doing that. But as we're doing more of that strategizing, I want to make sure we continue to communicate what the different data resources are and how they differ, and also how the different data sets can work together. So I'm hoping this presentation was helpful in working towards that. All right, I think I'm going to pass it back to Barry or McCain.
Thanks, Sumire. Thank you for that presentation too. We have a moment if folks had like just one or two questions before we go to breakout. So just ask if you use the raise hand if you had the question that was top of mind for Sumire. All good. Again, I think in a lot of these situations, we're both kind of awash in new information and also thinking about that new information in the context of what we do and how it connects with all that as part of it too. Um, Thanks, Amy, for the suggestion in the chat as well. Too often looking for ideas for future sessions, but also ways to kind of build on stuff like Sumire presented today in terms of this like really data piece, but how it all kind of gets organized. So I really appreciate that part, Sumire, too, the way you're looking at it and thinking about it, so that it is kind of connected and coherent that way as part of it. I'm gonna ask Rebecca to share slides again too. So what we're going to do next is provide space for folks on the call to connect with one another. I think while we may have been here to kind of connect everybody, it's actually the fact that your presence and the ability to connect with each other becomes such an important part of the work. And you all bring kind of the expertise and experience you all have in really important ways, whether it's from a particular sector, particular group that you may have a focus or work on, but also geographically across the state, it's really important too. And so you'll see three questions here on the screen. And what we'd really appreciate, and if you're open to it, we would ask you as you go into breakouts to consider these three questions, using those prompts for the conversation you can have with the group that you're with. But also, again, you may know somebody or you may learn from each other something about that you want another ask a question about too. So please feel free to do that as well too. You'll occasionally see folks like myself and Rebecca and Tanaya pop in rooms just to kind of join you if we can, but really want to create space for you all to connect with one another and have conversations both about what Sumire shared, but broadly about how you might use data in different ways you might bring different sets of data and information together. Let me do a check with you tonight. I feel like we're all set with the breakouts.
Yes. Would you say, Barry, we have around 10 minutes for breakout room discussions and then we come back to the main room?
That's right. Yep, that's right. And also just to note, thanks tonight too, if you were looking for American Sign Language support in your session, please let us know. We have two really wonderful interpreters here who can join you in that session. So please just drop your name in the chat so we know we can put you in a room or make sure that the interpreters follow you into the room that you'll be going into. With that, you should see it pop up in a second. And please use this space to kind of connect and share some of your experiences.
Welcome back, folks. Just going to give another few seconds. I think everybody is back. We would love to hear a little bit what you all talked about in your groups, if anyone is willing to share. I know we had a great conversation in my group, which I can share if nobody else is feeling brave. You can also feel free to throw it in the chat. In our group, we were talking about maternal health indicators, and Amy, please fill me in if I get anything wrong. But one of our group members was working on a dashboard for maternal health indicators in the city of Worcester, and a lot of folks were noticing that their experience with new parents who were breastfeeding didn't actually align with what the data was showing. The data was showing a very high percentage of new parents who were breastfeeding because of how the data was collected and how that was measured. Basically, if someone attempted to breastfeed while they were in the hospital, then they were categorized as breastfeeding, and it didn't capture the nuance. And so they had to kind of go back to the drawing board in terms of what they were actually presenting, in order to make sure that it was creating a more accurate picture. Oh, and then Barry chimes in the chat that their group touched on centralizing and connecting data, which is a really great point. Again, definitely coming back to what Sumire was talking about. And there was interest for a methods discussion or group, as well as exploring how we might start to close some of those gaps between the electronic health records data and other clinical data and public health data sets, which I think is awesome. And definitely to Barry's point earlier, we're always looking for new topics for webinars. So definitely share if there are any other things that you all would be interested in talking about. If nobody else wants to share, I am going to pull up my screen again so that we can share some resources and touch on a little bit about what's next. Sorry, my screen is frozen here. Just gives you a minute. All right. So some resources that we would love to direct you toward. Thank you, McCain, for throwing the CHEI link in the chat. Also the Mass Health Data Tool. We also always love to plug our Data to Action Guide, which runs through some of those steps in that process with the gears that we showed earlier, as well as a smaller guide about how to interpret and contextualize data. And then the last piece is the MDPH data library, which has tons of information, including links to FIT, the Population Health Information Tool, and all of its dashboards, as well as the Mass Health Data Tool. And thank you, McCain, for throwing all those links in the chat. And I believe I'm going to turn it over to you for this last slide.
So just in terms of kind of what's next, if you're interested in exploring CHEI data in particular, put our website mass.gov/CHEI. If you want to look specifically at our data, there's a link to the data page, if someone will throw that in. And there you can navigate to our data and action support page, which, and we'll also share a link directly to that, but that's where you can, there's a button to submit a request to get data and support. You don't have to know what data you want. You can just say, I know I want some data. I'm not sure exactly what. And the data and action support team, so probably Rebecca or Tanaya, will reach out and schedule a time to meet with you and talk more. So you don't need to have a plan around data to fill out that form and connect with them. And then you can always just contact us as well at CHEI. We have one more slide. Okay. So I think if you were on our last webinar or watched it, we said we would have more information about sort of the future of CHEI. We're hoping to be able to share that soon. Final budget decisions are happening here at DPH. And that may include a new round of community health equity survey. And so we're planning for that. Nothing is finalized, and we will share more as soon as we know. So more uncertainty in a already uncertain time, but we will share more as soon as we know, and still available if you contact us or reach out to the RDA folks to support you with the data that we do have. But thanks everyone for joining us. Great to see you all. And we'll be back soon with more webinars. So let us know what you'd like to see, what would be helpful. Thanks, Rebecca. Thank you to our interpreters and our partners. Take care, everybody.